I'm Dr. Gurpreet Padda, regenerative and interventional pain physician here in St. Louis at Regenerative. I've always been an outsider in medicine, the one who questions the procedure everyone else accepts as inevitable. And knee replacement is treated as inevitable, the end of a conveyor belt you've been on for years. Before you accept it as your only future, I want to show you what the evidence actually says about the surgeries leading up to it, because a lot of it should stop you cold. You've been managing this knee for years, the shots, the scopes, the bracing, the slow narrowing of what you can do. And now the word replacement is on the table, and part of you is terrified, and part of you just wants the pain to stop. That exhaustion is real, but a major surgery you can't undo deserves a harder look than the assembly line gives it. You're not avoiding reality by asking questions, you're protecting your future. Here's the promise. I'll show you what the rigorous trials reveal about the common knee surgeries, the uncomfortable truth about how long a replacement actually lasts, and the regenerative and metabolic path that may let you delay or avoid the operating room entirely. This is about making the decision with the full picture. Start with the surgeries that lead up to replacement. Arthroscopic cleanup for knee arthritis was tested against a sham operation. Fake incisions, no real procedure, and the real surgery was no better than the placebo, according to Mosley 2002. A second rigorous trial confirmed it. Arthroscopic surgery added nothing over proper non-surgical care in the Kirkley 2008 study. Now, the replacement itself, it's a genuinely good operation for the right patient, but it is not forever. In pooled registry data, only about 72% of total knee replacements were still functioning at 25 years. That means a meaningful share fail, and a revision surgery is harder and works less well than the first. The implant has a clock on it. The non-obvious follow the money truth. Knee surgery is a massive industry. When the placebo results came out, researchers noted the billions spent might be better used elsewhere. Replacement is a complete economic package. Regenerating and preserving your own knee generates almost none of that. So the system's momentum points toward the OR. It's not because it's always your best option, but because it's the most lucrative one. Your knee is, economically, a product line. The knee preservation plan. 1. Before any irreversible surgery, get the metabolic and inflammatory workup, fasting insulin, triglyceride to HDL, HSCRP. 2. Cut the acellular carbohydrates and industrial seed oils feeding the degeneration. 3. Pursue evidence-supported regenerative options and precision care aimed at preserving the joint you have. 4. Reserve replacement as a genuine last resort on your timeline, not the assembly lines. Many knees have far more road left than anyone told you. A knee replacement might be right someday, but someday is not the same as now, and inevitable is a story the conveyor belt tells. Choosing to preserve and regenerate is metabolic sovereignty. At Regen.MD, knee preservation is what we do before we ever talk about replacement. If replacement is on your table, book a consultation, and let's see how much knee you can still save. Stop managing, start regenerating.